Joining us today to talk about the importance of logistics in this changing healthcare market is Robin Hooker, Director of Healthcare Marketing for UPS. Robin, good morning.
Good morning, gentlemen. It's great to be here. Thank you for having me.
Yeah, great to have you on here. We've got two Atlanta companies talking to each other, so we all know how great this weather is today, right?
Oh, I couldn't ask for anything better. I had to actually step away for a small medical procedure today, and I thought, wow, what a great day to be out chasing little round white balls somewhere else. But wonderful stuff. Good to be on the show.
Yeah, Robin, obviously, our audience knows UPS. Talk specifically, though, a little bit about this healthcare vertical and what you guys are doing there, and then we'll get into the logistics and specifically around consumerism.
Great. There's a lot of exciting things going on in healthcare, and UPS has been eyeing in this industry for several years now. We've been operating within healthcare for decades, but in earnest, there was significant investment made by UPS in the early 2000s with acquisitions of a company called Livingston out of Canada. It was sort of our foray into the healthcare space. They had a distribution warehouse network. Once we plugged in and really started to take a look at key industry metrics such as the aging of the global population, the rising of the middle class, combined with the increased urbanization in some of the global marketplace areas, we really knew that we were onto something, and we invested heavily in building out a global distribution network to serve growing market demands for healthcare. It's been exciting because as we've made that physical brick-and-mortar investment, we've beefed up our transportation solutions around healthcare, deepened the conversations, the connectivity I heard earlier on. In the same way, personal health and Fitbit, you need to be plugged into your personal body telematics and metrics and vitals. There's vital signs for transportation and distribution and logistics. Those are top of mind right now for all of the key players in healthcare supply chain. There's regulatory frameworks that are being put in place to make sure that all of our medications are safer and more secure. We'll talk about that a little bit further down the line. But there's a lot of interesting activity. The reason why we're in primarily is the complexity is very attractive to UPS. We're an engineering-based company. We like the opportunity to showcase what we can do in the healthcare space because we're so good at engineering custom solutions, special operating plans, building those out into repeatable models that we leverage in the marketplace.
Talk about the trend of the rise of the neighborhood clinics like CVS, MediClinic, MedPost, et cetera, and what that impact may have on traditional caregiving.
Yeah, it's a fascinating trend when you look at it, particularly in the U.S. and what CVS has done. The first announcement was that they were going to yank all tobacco products, and I think everybody's ears perked up because I think the financials on that were probably somewhere in the billions range. And then they were rebranding in essence, and this shift of it's definitely the center of gravity is moving, or it's in flux, and the shift away from the traditional care venues into retail models and even the home care models, I think is something that we're going to see dramatic changes going forward. What it means for, I think, the consumer, I think, is greater market access. With the retailization, you're going to have better experiences. The experiences that I'm familiar with minute clinics they're very quick and easy. I even talk to the caregivers in those settings, and they're actually very happy to be in an autonomous setting. They're calling a lot of their own shots. I think the consumer finds it as a win-win. But they serve a marketplace. I think the traditional provider network, the infrastructure we're seeing now, is alive and well as well. And that piece is also shifting as hospitals consolidate under affordable care, and they're starting to actually acquire some of the non-acute care settings, the home care, the residential facilities. They're also expanding their footprint. This means a lot of interesting things in terms of supply chain and how medications, vaccines, and other items are actually pushed out into the marketplace. It's exciting, and I think on top of that, the consumer side, where more medications are actually flowing directly into the home, is actually another exciting area as well.
Hey, Robin, there's a direct correlation also to what's happening in telehealth, correct?
No, absolutely. From the UPS side, there's a lot of patients I think that are being discharged sooner than they have been in the past, or they're not even in an admission setting with a hospital. And part of that is this readmission penalty that we have under the Affordable Care Act, and it's doing something that's creating some efficiencies, but it's also creating a lot of logistic complications, meaning a patient normally might have gone into an ER and gotten admitted because their cardiac rhythm was at a level that was of concern. Now there are remote monitoring devices, and we're transporting these right now, that the patient can be discharged. They're given this device. It attaches to their Wi-Fi network, and they wear this. And from the iPad, the medical provider is able to keep tabs and know when things are, vitals are in and out of the green range, so to speak, and you've got, this telemetry on a patient that was really never accessed before. And usually what happens is after 1 or 2 months, things are perking up, diet is improving, exercise. Well, that device, which is not a cheap device, it has to make its way back into the supply chain, get refurbed, and then pushed out to another patient. And there's a lot of interesting logistics moves that go along with that, distribution and reclamation of some of these remote monitoring devices. They're high turn inventory items, high value, and we're serving the industry by providing not only just the transportation, but the visibility, the information on where these items are and when they will be back. This is allowing some of these firms to actually keep very lean inventories and maximize their profits. And ultimately, we're keeping the cost of healthcare down. And as we approach 20% of our GDP in healthcare, that's a good thing in the U.S., right?
Yeah, it is.
Robin, this is Ron Bachman. The Institute for Healthcare Consumerism and the whole term of healthcare consumerism is about options, choices, flexibility. And the fascinating part about the discussion today with you is you're allowing us to sort of peek under the sheets a little bit more about some of the delivery systems that facilitate those choices for consumers out there. You talk about the supply chain. That's sort of an insider term. I'm not sure our full audience appreciates that, but I guess in a layman's term, let me put it out that I think of UPS as efficiently taking something from point A to point B. And there's a whole lot in between there, but it's kind of an airline and get me from point A to point B. But now it's really so much is going to the consumer. Talk about that aspect, about all the needs that you see of things getting from, whether it's from a business to the consumer that you're facilitating, medical devices, pharmaceuticals. So instead of having to go someplace and pick this up, it's going to be more like a Zappos. I can get delivered something. I can order something online that night, and I almost get it delivered the next morning, a new pair of shoes. You're really moving that into the healthcare space, recognizing that there's different capabilities needed if something has to be in a certain packaging or has to have a certain temperature or certain capability to be delivered. That's what you're really talking about here, isn't it, about healthcare consumerism from your perspective?
Absolutely, and I'll touch on a couple topics there. So think of point A to point B, and point A happens to need to be temperature controlled for 2 to 8 degrees Celsius, which is refrigerated temperature for all of our biologic drugs like Humira and Enbrel and all the others that we're seeing on television right now. That storage is in regulated, FDA sort of certified healthcare space, and there's global, regulatory bodies when you get into overseas areas as well. What does it mean for consumerism in terms of receiving medication at home? I think the trends in healthcare consumerism are these. Number one, DIY or DIY, do it yourself. More and more medications are being pushed out. They're cold chain, temperature sensitive medications, but they're coming out self-injectable, self-administrable, and they're temperature sensitive because they're biologic based. I would be remiss if I didn't mention a solution that is gaining huge amounts of traction at UPS, and it's called UPS My Choice. Anyone that receives a package at home can go on to our website right now and register for My Choice. From that point on, any future delivery that has your name, and you can register your nickname and your family members' names, but regardless of what the shipper does, in terms of giving you the tracking number, maybe by an email, you're going to get a notification to your mobile device, either through a text message or an email, the day before and the day of delivery. That's wonderful for the Zappos delivery and the Amazon package, but when you're talking about a biologic, it could be life-saving or at least preventing something like a temperature excursion on something that could either lose efficacy or actually be harmful, if something's getting worn on the Arizona porch, in the middle of summer. So this My Choice tool lets you not only see that the package is coming the day before and the day of, and imagine your pharmacy is pushing this product out on a Friday, and you get a notification it's coming on Friday, but the weekend happens and Monday comes around and life happens, right? And you've forgotten, you're both working and everyone's away from the home, and here's this product sitting on the porch. You go in through your garage door, 2 days later you're out of your medication, and now your medication's expired, or there's a concern, or somebody brings it into the home and it hasn't been refrigerated and it's now a little bit dangerous and it still goes into your refrigerator. The connectivity that we're establishing with some of these delivery systems are very, very exciting. And when we talk to pharmacies and specialty pharmacies and med device, distributors that are pushing directly to patient, you couldn't ask for a better solution on this. And probably by now, statistically, probably 400 people have signed up. I'm hoping that your listeners also take advantage of this. One caveat. You will know everything that your spouse orders, and they will know what you're ordering if they've registered, and it can spoil your birthday or Christmas sometimes. So,
well,
hey, Robin, let me ask this question because you bring up what is UPS? What are you doing right now, or is it an initiative you to make the consumer, the health plans that have their members, the employers with their many employee consumers, they're turning into consumer-facing programs, more aware of what you guys are doing? Because it's a very interesting discussion. And, what are your plans, or what are you doing right now to make both that consumer, that health plan, even that employer with many, consumers, under their employer-sponsored plans aware of what you're doing?
Right. We're having dialogue with those administrators of those plans. We're having dialogue with the pharmacies, the PBMs, the big pharmacy benefit managers that are distributing this critical product. And it's all about what was mentioned earlier in your previous segment. It's all about connectivity. It's all about the information flow of the product. It's about getting it back if the connectivity doesn't occur. And it's also about, there's things that, firms are asking us to do, which is, if they're covering a particular employee base. I've had firms talk about, pushing medication directly into the workplace in a special solution that allows people to grab it there. If in particular, a school district is registered. We're in very interesting conversations at high levels with some of the big payers, the insurers out there, the providers. And the key, we do a survey. It's called the Pain in the Chain Survey. And I don't want to get too technical, but this is the pain in the supply chain, or it's the logistics, the transportation mode. And we found that this whole notion of collaborative solutions is a strategy that's being leveraged to address regulatory issues in healthcare, market access, product protection for some of these either high expense med devices or high consequence biopharma drugs. And this notion that firms are now coming together and they're having the dialogue, it's wonderful to see that we're at the high level planning table, the strategic planning table, more often than not, and that we're developing in a lot of ways a collaborative solution to address patient needs.
Robin, very interesting discussion, and I look forward to all of us getting together in the near term and continuing this, and even invite you to come to our event in Atlanta, June 23rd to 25th.
I'd be looking forward to that.
Yeah. Give our audience 2 or 3 takeaways. Kind of wrap this up. Give our audience 2, 3 takeaways, and let them know how they can connect with you as well.
Absolutely. So, a couple things. I want you to understand, everyone is familiar with us as a package delivery company. Yeah. You're not going to see our guys wearing a surgical mask, but in a lot of ways, we're presenting and delivering solutions, we consider ourselves fully embedded in the care delivery model. And part of our implicit process when we collect product for delivery and free up firms to do what they do best, which is invent, innovate, and deliver care, is that when we pick that product up, we're looking at it as a patient and not a package. That's how we deliver and execute on the product. We've got a biologist on staff that's engineering some of these key packouts and cartoning solutions to keep items cool. We're sending data loggers through our network to keep the temperature metrics, to have a better understanding of the thermal profile of our network during winter and summer. And we're investing heavily to secure the pharmaceutical, the medical device supply chain, but not just secure it, make it more efficient. We hope to keep the cost of healthcare down by helping firms engineer better solutions. To plug into UPS, the first thing I would say, if I had to leave every consumer out there, would say, go back, register for My Choice. You won't regret this. You'll love the connectivity. Everyone that's on this, it's one of those word of mouth things. People are very, very excited about this. If they want to contact me directly, email is rhooker@ups.com. Feel free to reach out. I'm the marketing director for UPS and help guide our conversation and our strategy for our forward-looking thought lines and where we tend to go in the future with our healthcare initiatives, and would look forward to further dialogue.
Thanks, Robin. Listen, sincerely, again, appreciate your time today. Enjoy your weekend in Atlanta.
Thank you.